Next, we will look at the genitopelvic pain penetration disorders. Genito from genitals, obviously. Pelvic area is what we're discussing. So genitopelvic pain penetration disorders. And there are two that we will look at. This includes vaginismus, which involves pain during the entry of the vagina. And then there is dyspareunia, which is a deep pain from within the vagina. The two often get confused, and sometimes people think, hey, they're the same thing, or they misidentify one of them. And so I think that we should break it down and talk about each of these just a little bit. When we talk about vaginismus, this is experienced when the vagina is penetrated by the penis or the toy at the opening area. And I want to be careful that often when we think about these genitopelvic pain penetration disorders, we think of intercourse, but lesbian women also experience these. So we should keep that in mind. Nevertheless, with vaginismus, it can be caused by a number of factors. It could be tissue irritation based upon the type of soap or products that the vagina has come in contact with, maybe the type of fabric of your clothing or particular toilet paper or other hygiene items you've used. If you've used some type of deodorant, feminine deodorant in that area, this could cause that. Additionally, it could be skin disorders like eczema or psoriasis and so forth. It could also be caused by hormone imbalances or insufficient lubrication. And that's why I'm such a big proponent of lubrication regardless of your age. Lubrication is so beneficial to make sex not only more enjoyable, but it makes it much more comfortable for your body, especially for long term. There are other factors as well, such as a lack of knowledge of how intercourse works. Oh, can you believe that? And this isn't guided toward females. Men really need to hear this one too. Sometimes you don't know how to have sex, and you don't know the proper way to have sex. And some people just try to shove things in, or sometimes the male partner tries to insert the penis in the wrong hole, and this is a big problem as well. And so, education for sex education can be something that's very beneficial in this case. Again, there are religious beliefs related to sexual shame that could be the cause of vaginismus. There are avoidance behaviors, and these can cause a person to be really anxious and cause severe stress and fear during sexual activity. I would also like to mention that about 25% of women who experience vaginismus also have a history of sexual abuse. So this is something that should be taken in consideration, as this issue would have to be addressed in therapy in order to help resolve her complications of intercourse. Now, when we talk about dyspareunia, which, like many of these disorders, can be caused by illness or medical conditions or surgeries and so forth, it can also, there are like factors within a relationship. And if there are problems with the relationship, then this could be a cause for dyspareunia. Sometimes there is what we refer to as a mismatch between the vagina and the penis. If or when the penis hits the cervix, it's very unpleasant for the female, and it can cause a lot of pain. But this can be easily resolved by using a rubber donut that a man can put along the base of his penis so that he doesn't go too deeply inside of her. And you should be aware that all of these female sexual problems that we are talking about when it comes to vaginismus and dyspareunia, that these are medical conditions. And as a sex therapist, I would recommend a female go to a gynecologist. In fact, for everything that we've talked about, if a female came to me complaining of some of these symptoms, I would first have her go to a gynecologist in order for them to rule out any medical aspects. This is the same when it comes to psychological disorders and things as well. You often would have them go to a physician to get looked over, to get, to get a medical doctor's opinion to rule out certain things in order to make a proper diagnosis. All of these are listed in the DSM because there is really such a strong link between psychological factors, and these disorders. And so it affects the client's well-being, their perception of self, and of course their relationship. And while the diagnosis must be made by a gynecologist, as a sex therapist, we do provide treatment for these disorders. And treatment often comes in the forms, in a variety of different forms, to be honest with you. But you must take into account, the specific needs of the individual, their background, their cultural background, their religious background, socioeconomic factors, and their condition. And so it can range from anything from cognitive behavioral therapy, couples therapy, to recommending things like the donut or dilators to be used in the vagina.